Okay, so just a few gentle reminders. This is week 3 in our 6-week yoga course. Just remembering yoga is all about breathing and moving. The goal is not to be the most flexible. There's no competition. So just taking your body as it is today. It's going to be different each time. We're just going to move and see what makes it feel better. Okay, so remember listening to your body. I can't feel what you're feeling, so trust your body, trust yourself. If something doesn't feel right, please stop and ask me again at the end. I will try and look, if you are having your camera on, I'll try and peek a bit more and see and check out your postures and everything like that. Another reminder, if you are pregnant, if you're watching this later, make sure that you use a wedge or a couple pillows to make sure you're not on your back for too long. And if you do have a prolapse, just make sure when we're doing the breathing that you're really focusing on breathing into the ribs more so than breathing straight down into the pelvic floor. If you don't have a prolapse, likely we do really want to breathe into that pelvic floor as well as the ribs. All right, so with that, we are actually going to start in standing today. So go ahead, stand up on your mat, and we're just going to bring awareness. So just feeling what your feet feel like on the floor. Do you feel like you're standing more to one side or the other? Look down, maybe notice if one of your toes is more out or more in than the other foot. Just noticing where you are right now. You don't have to correct anything, we're just checking in, seeing where our body is, and work your way up. Any pain in the knees, any tension? Do you feel like your knees are bent or straight or even flex back a little bit further? And just noting, how do your hips feel and your back? Any pain or cramping in the abdomen? Any tension in the chest? Where is your breath going? Is it up in your chest, in your belly, in your ribs, in your back? Where are you feeling your breath now? Any tension in your neck or your arms? Are you holding stress in your jaw or your forehead, maybe between your eyes? And just noticing any feelings that you might have been holding on to, and just noting them, acknowledging them, and then coming to your breath. Breathing in through the nose and out through the mouth. Starting to make that breath longer. A little bit of a longer inhale and a little bit of a longer exhale. And trying to send that breath into the ribs, expanding that rib cage, letting that pelvic floor drop. Exhaling, returning to normal. And now trying to send a little bit of your breath into the front. Feeling how that feels. And then focusing on the back of the pelvic floor, sending that breath further back. Can you get the back of the pelvic floor to relax with the inhale? And then you might try focusing on the right side for a few breaths. And then on the left. And now we're going to come and adjust our posture. So looking down at your feet, trying to have your feet about hip distance apart. So hip and knees and feet are all in a line. If your toes are out at all, try and bring them in so that your big toe is pointing straight forward. If you notice that your toes are a little bit scrunched together, try and spread your toes gently having a nice firm base of support. If you notice your arches are really dropping, gently bring your knees and hips and lift those arches up slightly. Soft bend in the knees now. And then feeling for our rib cage again. Are our ribs straight over our hips? So go ahead, feel your ribs and feel your hips. You might need to bring your ribs back slightly. And then dropping your shoulders down, relaxing your shoulders. Now we're going to come into our mini squat. So just bending your knees and sitting back like you're sitting into a chair. If it feels good to bring your arms up, you can do that. Making sure that you're not arching your back, but keeping nice and steady, and just gently bringing your arms up. Making sure you're holding most of the work in your glutes and you're not holding it too much in your quads. Nice and relaxed. Sit back into that chair, and then exhale, stand up. Let the arms drop to your side. And we'll do a couple flowing inhale, reach up if that's comfortable, and exhale, return to standing. Inhale, sit back into that chair. Exhale, return to standing. And a nice hold on this one. Inhale, keep breathing. See if you can relax your pelvic floor. Dropping the arms if that's too difficult, if the back is hurting, keeping your arms down at your sides. 2 more breaths here, really sitting back. And then coming up to standing. And now we're going to inhale our arms up, exhale through heart center. Inhale, arms up. And then on the next inhale, we're going to step our leg out into a lunge. And we're just going to lean side to side, flowing with your breath. And then once you feel ready, we're going to hold a stretch and just breathing. Remembering that we just need a gentle stretch, not pushing through, finding that comfortable stretch and focusing on your breath. And then coming to the other side. And if you want to do a couple more back and forth, I want you to find your way to the top when you're ready. We're going to gently turn our toes out now. And we're going to try some squats from here. So just a gentle squat down, arms up if that feels good. And then coming up. And just flowing with your breath. And on the next one, we're going to hold it here. You can keep your arms out or you can bring them to heart center. And focusing on your breath, can you let your pelvic floor relax here? Breathe in, relax, finding that comfortable bend for you. And then we'll do a couple more. Come up, hands up through heart center. Now coming down with the hands. And then breathing up. Good, and then on the next one, we're going to step back feet together, hands coming through heart center. We're going to gently come to a seated position on our mat. And we're going to come down into our bridge position. So having your hands wherever they're comfortable. And we're going to start with just our rocking our hips back and forth. So inhaling, letting that arch, that back arch up. Exhaling, pressing that back firmly on the ground. Keeping it in the range that's comfortable for you. Inhaling, back arches. Exhaling, back comes flat. Going at your own pace. And then starting to make those circles. So as you inhale, coming down to the right side and letting every part of that right side come down as you arch up. And then exhaling to the left, rolling back up, back is flat. Inhale, tilt down, and rolling in your circles. And then switching the direction of that circle. Inhaling, letting that left side come down. Exhaling up on the right. Flowing with your breath. And when you feel even, coming back to the center, taking a breath or two here. And then coming up into your bridge. Remembering we're trying to use the glutes here, keeping the front of the thighs nice and relaxed. And holding this for a few breaths. And coming back down. And then bridging up again. Lifting your bottom off the ground as high as you feel comfortable without letting the front of the thighs grip on. And then releasing back to the floor. Another bridge up. Making sure you continue your breath. Now switching to in and out through the nose if that's more comfortable, or you can keep in through the nose and out through the mouth. And then relaxing down. You might want to wiggle your hips a little bit here if that feels comfortable for you. And then we're going to inhale, the right leg up, crosses over the left into our figure four stretch. Staying here if this is comfortable, or pulling the left leg up towards your chest. Trying to feel that stretch in the back of the legs. No pinching in the groin. And then with your right hand, you can grab the outside of your right foot and come into happy baby, or you can just grab behind the right knee. If this is comfortable, stay here. Otherwise, for a bit more, you can stretch out that left leg straight on the ground. On the next exhale, we're going to let that right leg cross over, coming into our twist. Right leg goes across the body. Right arm stretches out. You can use your left arm to put a little bit of pressure on that right leg if that feels good. Turning your neck to the right if you need more stretch, to the left if you need less. Feel free to bend the left knee up if that's more comfortable. Finding that comfortable stretch and breathing. And then on the next inhale, coming back up, grabbing behind the right knee, coming into our hamstring stretch. Finding that comfortable stretch, straightening that knee as far as is comfortable. And then adding some pointing and flexing of that foot in a comfortable range. And stop in a comfortable stretch and hold the leg here while you breathe. If it feels good, you might squeeze this leg in before you release it down. Inhale up the left, crossing it over, coming into a figure four. And taking the left hand, grabbing the outside of the left foot, letting the right leg straighten if that's comfortable, or grabbing behind the left knee. Inhaling, letting that pelvic floor relax. Exhaling, returning to normal. On your next exhale, we're going to let that left knee cross over to the right. Right arm can help hold it down if that's comfortable. Left arm reaches out to the side. If that's a bit too much, bend up your right knee so both of your knees are bent. And find a comfortable twist for your neck. Looking over to the left if you need a bigger stretch. Looking to the right if you need less stretch. Inhaling, coming back, grabbing behind the left knee, finding that hamstring stretch, straightening it as much as you can, and adding your foot up and down. And finding that comfortable stretch and holding it there. Focusing on your breath. can hug that left leg in if that feels good before releasing it down. And just stretch our arms and legs as wide as you can. Big stretch here. We're going to bring our knees up. We're going to come into sitting so you can turn onto your side or you can rock yourself up. And we're going to come with the right leg in front, and then the left leg is going to go behind. Sitting up as tall as is comfortable with this stretch. If you need a bit more, you can come forward, or you can lean back, depending which hip is tighter for you and where you want to feel that stretch. Come into a comfortable position. And then coming up, back, sitting tall, and then switching your legs over. Okay. And just like the other leg, if you want to give it a little bit more, you can lean forward or lean back, finding a comfortable stretch. Then coming onto hands and knees. If you have knee trouble, you can stay sitting in the chair or use a chair. We're going to do cat-cow. So inhaling, gently looking up, letting that neck comfortably come up, back sags down. Exhale, arching your back. Flowing with your breath, you can hold it in one position or the other for a few breaths if that feels good. And just looking down at your hands. Hands should be under shoulders. And feet should be right under your knees. Keeping that neck comfortably relaxed. Finding the range that works for your body fully. And when you feel even, meeting back in the middle, you're going to widen our knees a little bit and sit back into child's pose. Using a pillow at your knees. Focusing on breathing into your lower back. Keeping your neck comfortable. You might need to turn it to one side or the other. Keeping your arms nice and relaxed. And your shoulders relaxed, your neck relaxed. Now you can stay in this position if it's feeling good, or if you want to flow with me for a few breaths, you can exhale, come up onto your hands and knees, and inhale, lean back. Exhale, coming up, inhaling, lean back. And coming back to a seated position. back down, bringing both knees up to the chest, and then letting them fall out to the side. If you prefer happy baby, you can reach up and grab the outsides of your feet, or you can stay here. You might rock back and forth, side to side, giving that sacrum a little bit of a massage, if that feels good to you. If you're feeling any pinching in your groin or hip, just relax your feet down a little bit more. And then we're going to give ourselves one big hug. If it feels good, you can bring your head up, forehead to your knees. And a big squeeze here, compressing the body. And then relaxing out. If it's more comfortable for you to keep your feet bent up, keep them up. If you feel comfortable stretching all the way out, your body might feel like it needs to take up some space. Bring your arms wide if that feels good, or you can keep them closer to your side, finding a position where you can relax and be still. Noticing how the breath feels, going in through your nose. Any thoughts start to wander into your mind, just noting them, and then focusing back on the breath. Any last tension that you might find yourself holding, breathe into that area and see if you can relax. And start to wiggle your fingers and your toes. And when you're ready, roll to one side and push yourself up into sitting. You can keep your eyes closed if you want to. And then we're going to come all the way up into standing. Coming into that first pose that we took today, just standing up tall and breathing and bringing your awareness back to your body. How are your feet feeling now against the ground? Just noting any changes or differences you might feel in your feet or your knees, in your pelvis, in your back, in your abdomen, in your chest and shoulders and arms. How does your neck feel? How does your head feel sitting on your neck? And tension left. Take a couple more breaths here. And we'll just thank ourselves for taking the time to focus on ourselves and our body and move and feel good. So if you want to, you can say namaste.